Hello and welcome to tonight's edition of the PharmAssist Virtual Learning Experience. Before we get started tonight, I'd like to just quickly read off a disclaimer. The PharmAssist Virtual Learning Experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that out of the way, I'd like to welcome you yet again to another edition of the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your very own home. PharmAssist typically takes place live every Monday at 7 p.m. Eastern Standard Time, but tonight we're going to do something a little bit different. We are going to bring you some clips from our second month of the PharmAssist program, where you will get a chance to hear from each one of our amazing speakers as they share some of the products that they discussed. So we're going to have tonight Karen Hammond, we are going to have Caitlin Endicott, we're going to have Laurel Meyer, and we're going to have Wanda Hofgesang. Yet again, they're going to join us and walk us through a great discussion about the products themselves, and then also the Q&As from those nights respectively. So you're going to get a chance to kind of see how the program goes, and while normally it would be live and you'd be able to share your questions and answer them live, tonight, although it is only going to be a recording, we are also going to make sure that you can put any questions you may have into the Facebook page, and we will get to them as soon as we get a chance. So again, thank you so much for joining us tonight, and we are going to have an amazing time listening to all four of the nurses walk you through some of these products with the Q&A. You can be joining us typically via Zoom or Facebook Live. You can watch this video on Facebook Live as well as on our page as well, the mymandelsPharmacy.com page. And so thank you very much for joining us, and get ready for an amazing PharmAssist program tonight. Take it away, nurses.
Your healthcare provider has recommended that you take progesterone in oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone in oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil, and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all, and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol. But with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle, top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just one time. We know you're already clean. Just wipe it one time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. Excellent. That wasn't so bad, I hope. I know people are intimidated by the longer needle with the as opposed to the subcutaneous injection needles that have been given with some of the other medications. But it's important that this medicine go into the muscle of the hip. It is an oil-based medication, and it is absorbed better if it gets into the muscle. If you put it directly into the fat, it may just sit there for a while. It'll probably still be absorbed, but it does better if it's directly into the muscle. Certainly, you're not going to have redness or irritation or lumps or bumps or tenderness if you put the needle in all the way and make sure that it is deep into the muscle. It's only when it leaks out into the fat that it's going to cause some of those bizarre symptoms like that. So what I do for my patients is right after they have their egg retrieval, I will take a Sharpie and draw little parentheses on their hips, right where that injection is going to go. Just because the spouses are usually pretty good at hitting targets. Again, here's my diagram, and I would just draw parentheses right in there. So you can give the injections anywhere right in the parentheses. Sometimes I'll have patients try to give it right in the middle of their hip, and they think, or right in the middle of the buttocks, and they think, oh yeah, that's where I've got lots of tissue, so I'm going to make sure that I get it right there. Actually, the way women are built, that's where you have the most fat is going to be right there. Again, this needs to be in the muscle. So it's way up in the corner, and that's why you want to put the needle straight in all the way and then administer the medicine. Now, some people ask me, what if I do see blood? Do I need to pull back? And they're a little intimidated about that. Actually, in nursing schools now, that's no longer even taught that you should pull back. I've been doing this since 1981, and I have never given an intramuscular injection where I pull back and I get blood. You may, or tomorrow may be the first time I ever see it. But it's so uncommon, I wouldn't worry too much about pulling back on the plunger before you put into the medication. So I'll open it up now and answer any questions that you have.
Thank you, Karen, very much. So first off, I just want to remind everybody, if you are joining us on either Zoom or Facebook, feel free to type your questions right in there. On Zoom, you can put it in the Q&A section. On Facebook, you can just type it right on the page, and we will get to everybody's questions. This one, as you mentioned, Karen, a lot of times there's the most questions about this just because it's a little bit more complex. People think or they've heard things, and so this is a great way to kind of put those potential thoughts to bed. So one of these questions is very basic, just says, what does the progesterone in oil actually doing for my cycle?
Great question. I love it when patients ask specific medical questions and want to know why they're doing what we're asking them to do. I love that involvement. So progesterone is a hormone that the leftover sac that the egg was in makes after ovulation. So after ovulation, that sac that the egg was in becomes a functioning gland. All glands make a hormone. This hormone is progesterone. What happens with this is it stabilizes the lining of the uterus. Estrogen builds the endometrium or the lining of the uterus, and progesterone stabilizes it. So in a spontaneous cycle, the lifespan of that corpus luteum is about 2 weeks. And then after that, the progesterone levels fall if there's not a pregnancy, and that's when the period starts. When we do IVF, and sometimes other procedures, certainly with IVF, we not only just remove the egg, but we also remove the fluid that's in the sac as well, that's in that follicle sac. So sometimes that gland may not function quite as well as we'd like, and the progesterone levels may not be quite as high as we like. So that's why we give progesterone. It's going to stabilize the lining of the uterus, and you'll continue to take it through the early part of your pregnancy. Your provider will tell you exactly how long. But you'll continue to take it, have a pregnancy test, and once it's positive, you'll continue taking it a bit longer.
All right. Thank you very much for explaining that. I think it's good to understand the background of why you're taking all these medications, and so it's great that people are asking those questions.
Absolutely.
Another question that just came in, and so this may have come after when you were just discussing a little bit about some of the shot and the spot to put it in. Somebody just said, I'm nervous about this shot. How will I know if the injection is in the muscle or not? What damage could I do?
You know, if you give it, it would be hard to do damage, probably wherever you gave it. It'd be really hard to do damage. But if you give it in that muscle in your hip, that's a really big muscle. And if you do it way up in the corner of your hip, like I showed you in this picture, if you do it way up here, it's going to be pretty easy to put the needle all the way in and make sure that it's up to the hub and it should be in the muscle. If it's not quite in the muscle, it's probably going to be close enough. But it's very important you put the needle in as far as it'll go. People worry about hitting a nerve or hitting a blood vessel, or in thin patients, you worry about hitting a bone. Even if you did hit those things, it's not going to hurt anything. It may scare the giver just a little bit if you hit bone, but the patient, the one that's receiving the injection, isn't going to notice anything different at all. There's a big nerve that runs right down near the middle of each side of the buttocks that people worry about hitting. So if you stay away from the middle, you're not gonna have that problem at all. Way up in the corner. That's the most important thing I can tell you. To give it way up in the corner, and the other thing is to put the needle straight in all the way. Actually, when people take this injection, they're amazed at how much easier it is than they ever thought it would be.
That is great. Thank you. We're trying to put people's mind at rest and at ease so that you feel comfortable and know that you're probably walking in with a little bit more discomfort or nerves than you would actually will walk out of this whole process with. So it's great that we can make you feel comfortable now so you don't have to feel worried about it later. So this, I feel like you touched on it, but again, just because the question came in and it came in a couple of times, so it's something worth touching on again. A friend of mine injected their progesterone and saw blood in their syringe. This just seems scary to me. I know you said it's not a big deal, but how can I be sure that I'm not actually sticking it into a vein, and what could potentially happen?
it is so unlikely you could stick it into a vein. So don't let that be the least of your worries. That's not going to be any problem at all. If you do see blood, just pull back the needle just a millimeter or two, just a little tiny bit, and go ahead and administer it. If you put a drop of blood into the bathtub or even the toilet or the sink or whatever, a drop of blood is going to turn all the water to where it looks like blood, even though it's just one little tiny drop. So a little tiny drop of blood is going to make the fluid look like it's blood tinged or maybe even just all blood. But it's fine just to go ahead and give it. It is unlikely you're going to pull back any blood. You may have a little spot of blood when you take the needle out, but keep in mind there's blood running through every part of our body. So it's easy to nick a little vessel going in or out, but it's not going to cause any untoward problems at all. So please don't worry about that. Another thing that patients ask me about is, should they stand up or lie down, or what's the best position to be in when they are having these injections given to them? I recommend that people stand up, and whichever side you're getting the injection on, just lift that leg up a little bit to take your weight off of that leg. And that actually relaxes the muscle. So if you think about relaxing the muscle fibers, when you put the needles in there, it's going to be relaxed already. If you're tensed up when the needle goes in, that can cause a little bit more soreness. It's hard to say just relax, but that's the right thing to do. Relax, let those fibers relax a little bit in the muscle, and whoever's giving your injection will just put the needle straight in all the way. It's for you, it's unlikely to feel any different than any of the other medications that you've taken. For the person giving it, it's thicker. It is an oil. I said in the video that it's going to likely be sesame oil or peanut oil. We're fortunate that Mandel's is a compounding pharmacy, and they can put it in some custom oils like olive oil for those people that have allergies, or in ethyl oleate. There's some differences in absorption, so your provider will tell you if you should use ethyl oleate or one of the more conventional oils. So they will work with you with any allergies or issues that you may have. But again, it's so important you go in the upper outer quadrant of your hip, take your weight off that leg, have the giver put the needle straight in all the way, push in the medicine, and then take it right back out. Again, whoever's given the injection, you have to push a little bit. You have to push the oil through the syringe. But for you, it's not going to feel any different.
Thank you very much, Karen. And one thing we can just throw out there now, this is perfect time to say all of these videos, since they will be archived and on our website where you can go to mymandelsPharmacy.com and see them, this might be a good one that you can have your partner or whoever's going to give your shot watch it with you, just so that you can feel a little bit more comfortable that both people are, they feel comfortable with the process, and there's no surprises when you're giving the shot, because that's what nobody wants that. So that's a great chance to go check out what's over there on the website and watch those videos. So I do have this question that just came in that said, I left my progesterone out at room temperature and I forgot to refrigerate it. It's been 3 days now. Is it still okay?
Great question. Progesterone does not need to be refrigerated, just like you don't put your olive oil in the refrigerator. When you put an oil-based medicine in the refrigerator, it's going to make it thicker. It'll be cold and thick, and that would make it harder to give. So I would recommend this just be kept out on your kitchen counter or bathroom counter, just in a safe place away from children and pets, and then keep it at room temperature until it's time to administer it, and then just put it right back on that same counter after you give it. So progesterone and oil in any of these oils does not need to be refrigerated.
One less thing to worry about there. Glad that question came up. And we do have another question that just came in. It's kind of a similar theme we've gotten for pretty much every product. But what do I do about potential welts or soreness from my injection with progesterone? Is there something I can do beforehand, or do I just treat it after the fact?
Great question. And that's what people really worry about. Not only are they worried that the injection is going to be uncomfortable, or that they might have some adverse effects afterwards. I can really promise you, if you put the needle all the way in, it is so unlikely you're going to have that. A few things that you can do to minimize that likelihood. One is you can alternate hips. You can do it on the left one day and on the right the next day. Also go to different places in that target that your doctor or nurse will draw for you. Ask about if there's another place that you can give it. That is my favorite place for patients to take the medications, because that muscle is a little bit shallower and it's a big muscle. I generally prefer that patients not take it in their arm or their thigh, just because it can be a little bit more sore. The muscle in your arm is smaller, and the muscle in your thigh, it tends to be a little bit more uncomfortable as well. Other things that you may want to do is warm it up before you give it. Warm up your hip. You can put like a heat pack on there. Some people say cold, but I always go for warmth before an injection that's oil-based. Just put a heating pad on your hip to administer, 5 or 10 minutes before you administer it. That also helps to relax the muscle fibers. There are patches that are available called Centerra Patch that you may want to consider if you're really intimidated about the discomfort. The symptoms that you may have afterwards, especially if it does leak into fat a little bit, would be some redness or local irritation. Sometimes it can actually itch a little bit. So you can put a topical cream like Benadryl or a cream like that will help with the itching. The redness or lumps or bumps, should you have that, I would recommend you just alternate sides and go in different places in that same targeted area for the injections. If you should have problems with redness and swelling and it feels hot to the touch that you're concerned about it, always ask your healthcare provider. And your provider may have some extra hints for you just to make sure that it's easy for you and goes seamlessly. I have patients that dread taking the progesterone injections. And then when I tell them that they're sufficiently far enough along in their pregnancy that they can stop taking it, they're begging me to stay on it. It becomes almost like a crutch. And I thought, wait a minute, you said you didn't want to take it. You were worried about it. But then come to find out it's not nearly as bad as what you thought about. So again, I've said it over and over, put the needle straight in all the way, and give the medication.
Thank you so much, Karen. We appreciate it. And I will say right now that we've gone through all the questions. So at this point, we can open it up to pretty much anything. If you have any questions about any of the 3 products we talked about, or if you have anything tangentially related to the conversation tonight, feel free to hop into the chat on Facebook or jump into the Q&A section on Zoom. And you can type it in that way. And other than that, I will throw it back over to you, Karen, just as we're getting close to getting ready to wrap up with the program tonight.
Perfect. Well, I really appreciate y'all being with us tonight. We want to do this program for you, the patient, to make this journey a little bit easier. Your healthcare provider has an awesome relationship with Mandel's Clinical Pharmacy, and we want to work together to ensure that your journey is as smooth as it can be, and your understanding of the medications, their purpose, and how to mix and administer them is as clear as it can be. So thank you so much for giving us this chance to speak with you tonight. I know it's in the evening and your own personal time, and we really appreciate your taking this time out of your day just to have a better understanding of these things. We want all of your journey to be easy. Always feel free to reach out to your healthcare provider or to one of the pharmacists or clinical team at Mandel's Specialty Pharmacy, because we're all wanting to work together to make this as easy as possible for you. Keep in mind that all of the videos from this PharmAssist program are available on Mandel's website at mymandelsPharmacy.com /PharmAssist. But when you go to the Mandel's website, it's really easy to navigate to find where these videos are. Or you can find it on Facebook, on my page, or on Mandel's Specialty Pharmacy page. So you can maybe even play the video right before it's time or even during the time that you are preparing and administering your injection, just to have a little backup. I joked a little earlier that it could be like a Jane Fonda workout video, but probably most of y'all watching that are wondering, when was Jane Fonda doing a workout video? But you can just prepare it along with the videos that we have. It's fine to get second opinions. There are 4 of us from around the country who are preparing these videos, so you can get second opinions from all 4 of us if you'd like, just to make sure that you're very comfortable with it. And always feel free to ask any questions.
Now we will review how to use a Centerra patch. The patches will likely come in packages such as this. So I recommend just gathering your supply there and deciding what site you want to use. Now, the patch does need to be applied directly to the site that you plan on doing an injection, and it does need to be applied about 20 to 30 minutes prior to your planned injection. You'll take your patch out of the packaging. This is the top of the patch, so when it's on, this will face outside, and then the sticky part is here, and there is a plastic film over it that you'll need to peel off. So it comes apart like this. And this does need to be applied to skin that is unopened and clean. So if you have residual tenderness or scabs, I wouldn't recommend putting this over that skin. I would find a fresh new site. And then after that, you just apply the patch to the skin. Make sure it's flush against the skin. You do want to make sure to not cover up this outside part where it has these little vented holes. That's how the patch begins to do its magic. So when it's on, it'll actually feel kind of warm, and that means it's just increasing that blood flow in order to kind of absorb the medication even quicker. Once you have it on for 20 to 30 minutes, you can peel the patch off. And then prep the site for your injection. And that's how you use the Centerra patch. Okay, so another thing just to stress with the Centerra patch is be sure to take off the patch before you do your injection. I actually heard a story just the other day of that not being clearly portrayed with the patch. So don't do your injection through the patch. Make sure you peel it off after that 20 to 30 minutes. Cleanse the site with your alcohol prep pad, and then do your injection just like you normally would. Also, I forgot to mention, when you are disposing of the patch, you can actually press it back onto the packaging that it came onto, just because when you peel this off, the medication is in the center, so that keeps it sealed on there for when it's disposed of so that no one else comes in contact with it. Also, when you're using it and for the first time and peeling off where this medicine is in the middle, be careful not to touch it with your fingers or it's gonna, have that effect on other parts. So steer clear of the middle when you're peeling it off. It can be a little bit of a balancing act there to steer clear of the medication. I think that's it for me. What questions do we have about Centerra?
Okay, perfect. So the first question that came in says, you mentioned the little holes where we need to let it breathe. What happens if I don't let the patch breathe while wearing it? Is that going to be a problem?
So if those holes are completely, sealed tight against something, then the medication may not be activated appropriately. The patch is sealed in that packaging. Once you open it, you peel back that layer off to expose that stickiness in the medication. And once you apply it, then that numbing medication is activated with the air that comes through those holes. So that's why you want to make sure when you're doing this to be mindful that you are keeping that open. You may have some effects still depending on, how tight the seal is over the patch, whether it's clothing or whatever it is that's over it. But to get that maximum effect, you really want to be mindful and leave it open to air so that it can activate the medication.
That's great. Thank you very much, Caitlin. A question that just came in on Facebook says, is it possible, can I overdose on the medication if I leave the patch on too long?
So you really only need to wear this patch for 20 to 30 minutes, okay? It's ready to go. At that point, no need to overdo it. If you forget about it and leave it on for too long, you're not going to overdose on the medication. I would recommend setting like a timer though when you put it on, use your smartphone, your watch, whatever, to set a 20 to 30 minute timer. That way it's easy. You can go along with what you're doing, and then that will remind you to take it off and do your injection. So you can kind of get both done with the same timer. But ultimately, it's probably not going to hurt anything if you forget about it and it's on for a little bit longer.
Actually, I guess the exact opposite also came in. So everyone's trying to make sure they get the timing right on this. Will it still work if I only leave it on for 5 to 10 minutes before my shot, or should I delay a shot to make sure that I leave it on longer?
Good question. So the patch, if you do not have it on for that 20 to 30 minute time frame, it's not that it won't work, but it just may not reach its maximum effect if you have it on for only like 5 to 10 minutes. So depending on what injection you are using it for, it may be appropriate to delay your injection for another 10 to 15 minutes to reach that 20-minute mark. But if it is an injection that you've been given a specific time to take, such as like a trigger shot, I do not recommend delaying that type of injection. Typically, when your nurse gives you a specific date and time for an injection, it's for a very good reason. They've calculated things out based on whatever procedure you're undergoing. So I would hate for that to compromise this cycle. But that's something I would definitely, confirm with your nurse or your healthcare provider. But as just a general statement, I wouldn't let it delay a super time-sensitive injection, definitely. And again, I say this all the time to my patients, set a timer, make life easy, so you're not staring at the clock. Use your smartphone, use your watch, use your, all these devices they have now that you can yell and have them start a timer for you. Makes life so much easier. That way you know exactly when to take it off, and then you're ready for your injection all in the same time. Great question.
Perfect. And this is just another reminder again to bring up that, yes, always listen to your nurses or your healthcare providers when they tell you a specific time. There is a reason for that. So make sure that you are listening to them. And that's hopefully where all these things are helping you to make sure that you're doing it correctly in a way that makes your life easy. That's our entire goal, is how can we make it easy for you and also be able to follow those rules that you're getting from your clinic and from your healthcare providers. So that is it on the questions that came in right now for Centerra. Pretty easy. It seems like this one, most people understand it. So I will, again, give you a couple minutes, everyone. If you have any other questions, I'll throw it back over to you, Caitlin, if there's anything else you want to share before we decide if we are going to move on, if there's no further questions.
Great. Yeah, this is a great option for those who are maybe new to doing self-injections or a little nervous, have a fear of needles. It's just one less thing to have to think about, when you're injecting the medications. You just really have to worry about physically doing the injection. It's not as much as feeling what comes along with it. So I definitely recommend trying it. It doesn't hurt to try, but definitely confirm that with your healthcare provider. And just a side note, not even just with the patch or trigger injections, use, resources to make things easier. I know I talked about this, but setting a timer, or if you use an agenda or whatever you use, a planner to organize your life, use it for your injections. It takes off that added stress of worrying about missing an injection or something like that. Use those resources to make your life easier.
Hi, my name is Laurel, and today I'm going to show you how to inject the Ovidril trigger shot. The Ovidril trigger shot is used to stimulate the final maturation of the eggs in preparation for the egg retrieval. What happens is you give this shot approximately 36 hours prior to the egg retrieval, and it will stimulate the eggs to loosen from the inner follicle wall so your egg retrieval can be successful. Please make sure that you take this shot at the exact time that your clinic tells you to. So to give this shot, you're going to take it out of the box. It comes in a pre-filled syringe, so it's super simple. You just point it toward the ceiling, give it a few flicks, take off the top, and then you want to get rid of that air that's at the top. So you're going to push on the plunger, and you're going to get rid of the air until you see a little drip of liquid at the tip, like that. Now, to give the shot, you want to pick a spot in your abdomen. And you can pick any spot you'd like, as long as it's at least an inch away from the belly button. And there's some fatty tissue to squeeze. So this is going to be my abdomen for the demonstration. And what I'm going to do is just give it a good pinch and hold it at a 90-degree angle. I'm going to go in quickly like a dart, let go of the pinch, and then I'm going to inject the medication. Once the medication is completely given, you want to wait about 3 seconds. Take a Kleenex, pull out quickly, and hold your skin with the Kleenex. After about 10 or 15 seconds, you'll check your skin. If it's dry and not bleeding, you're done. If you do see some liquid, or if it's bleeding, you're going to hold it a little bit longer. Recheck it. If it's dry, then you're all done. Now, to get rid of this, you're just going to drop it straight into your sharps container without recapping. And that's all there is to it. Okay, Craig. There's probably some questions about Avadril. Be happy to answer anything you have.
There definitely are. Here we go. So you talked about in the very beginning removing the bubbles in the Avadril by tapping it in the beginning. So what happens if I see a bubble in the Avadril? Can it be dangerous? How do I get rid of it?
A lot of questions about bubbles. So yeah, little bubbles are okay. You do want to get rid of the large amount of air that might be in the top of the Avadril syringe. So if you look at your Avadril and you see air there, you want to get rid of that. If you have a bubble down here, you can flick it a little and it will rise to the surface. And then you just push until you see that drip of liquid at the surface.
Thank you very much. Yeah, I think obviously, again, people have watched enough soap operas, and so they want to make sure that bubbles are not a problem. And hopefully we've driven home enough that that now you know how to handle it and to not be afraid of them. So another question based on your presentation, somebody said you mentioned that it's very important to take the shot at the exact time they gave. How important is the timing of the shot? How exact do I need to be, and why do I need to be so exact?
So the purpose of the Avadril, as I mentioned, is to loosen the egg from the inner follicle wall, and it takes the Avadril, it takes this process about 36 hours to do it. So your clinic is going to tell you to take it at approximately, they might do 37 or 38 hours, but approximately 36 hours prior to your scheduled egg retrieval. And it's important to give that shot within 5 minutes of the time that they tell you. If you were to give it too soon and too much time had passed by, there's always a risk of the eggs ovulating, and then we can't retrieve them. After about 38 to 40 hours after the trigger shot is given, there's that chance that you may ovulate, and we would lose the success of the IVF cycle. If you gave it too late, the eggs could still be stuck on the inner follicle wall. And then when we go in to try to retrieve the eggs, they're still stuck. They're not free floating in the fluid, so we wouldn't be able to retrieve them either. So that's why the timing is so very important.
Perfect. Thank you. One question that just came in from Star on Zoom is, if you have there with you, I know obviously the videos were pre-recorded, but if you have there with you something where you can please repeat just the demonstration of the pinching of the skin and the injecting, and how you take the injection out, the needle out of the skin, so as not to hurt, on the way out as well. If possible, if you don't have the stuff there, you can walk through it or talk through it. Perfect.
Got it. Yeah.
Ready to go, Star.
So yeah, Star, no problem. So you're going to pinch your tummy, and if you give it a couple good pinches, it doesn't hurt as much when the needle goes in. So what you'll do, Star, is just pinch, go straight in like a dart, and you want to go quickly because that makes it hurt less too. Let go of the pinch and inject the medication. And you can do this at a moderate speed. It doesn't have to be slow or fast. You're going to want to have a Kleenex handy. After about 3 seconds of letting that medicine absorb into your fatty tissue, then you're going to pull out and you're going to hold your skin with the Kleenex. Just wait till it's dry before you let go.
Perfect. Thank you. And then this is a
You can always
question.
watch the video again.
Yes, and this is a perfect time to say that all these videos will be archived. So not only the full video, but you will also be able to see these individual videos. So if you're ready to go and you know tonight is going to be the night of your first shot, you can queue up the video, watch it with with whoever's going to be assisting with the process, so that they're aware as well. And it's there for you. With the beauty of the internet, you have it ready to go right when you need it. And we will share all the information again on where to find that again at the end, where you can get all of these videos. One question that comes up, and this actually comes up for almost just about every single product at every single time we've done one of these, but does it matter whether you are standing up or laying down when you're taking these medications?
It doesn't. I think the best position is to just sit or stand, because you want your belly to be relaxed and you want the fat be able to squeeze the fatty tissue of your belly. If you're lying down, it would be difficult to squeeze it. So I would just say sitting in a chair in a relaxed position is the best way to get the shot.
And a follow-up question that just came up from that, I'm not actually a big fan of belly shots. Can I give Avodrel in the arm or rear instead?
We do recommend the belly, but if you really do have an aversion to that, you can use the top of the thigh or the upper outer arm instead. We don't recommend the upper outer quadrant of the hip.
Perfect. Thank you. And you mentioned it before, and somebody says here, what does trigger shot mean? You mentioned how Avodrel works, but I guess the concept of just the trigger shot as the name, what are we at? Why do we call it that?
So trigger means to stimulate a reaction. Like when you pull a trigger on a gun, it causes the bullet to come out. Well, when we give Avodrel, it triggers the process of the final maturation of the eggs. It loosens them from the inner follicle wall so that they're free floating in the fluid. And then we can go in with the aspiration needle at the egg retrieval and take out that fluid, and the eggs will come along with the fluid. And we can retrieve them, put them in a test tube, hand them over to the embryology staff, and they can isolate those wonderful mature eggs.
Great. Thank you very much for explaining that one, Laura. I think those are the questions that sometimes we get caught up, like we said, in the minutia, and you want to get the bigger picture. And this is a great opportunity to ask those questions and to get a little bit of some knowledge about everything that's happening and how all the pieces fit together. So there is a question here that just came in that said, okay, that also we can actually partially answer this a little bit on the pharmacy side as well, but somebody who is asking, generally, that they don't have the medication. When would they know, like, when should they be receiving the different parts of the medication and the different parts of the overall treatment? And this is actually also a perfect time to say you can always reach out to your pharmacist. We have all of our pharmacists at Mandel's are always available for you to reach out to with questions such as, when should your medication be coming? There's constant contact so that you're never really unaware of when things are being shipped out, when they're supposed to be delivered. Make sure working between your pharmacist and your healthcare professional that medications are coming with plenty of time so that you can open up the package, look through it first, make sure you understand what everything is so that you know that all of your medication is there before you have to even get ready for your shot. So it's not like it's showing up and then, you got to get ready and start taking your shot immediately after that. So that's one of the great things about working directly with the pharmacist at Mandel's, is that we can talk you through all that and answer any of those questions about when to expect those medication shipments to arrive. I don't know if you have anything else you wanted to add about that, but that's just...
Well, we recommend to get your medications about a week prior to the first day of injections, just so you can get comfortable with what everything looks like and watch videos as needed. Absolutely.
Perfect. Oh, wow, now they are starting to come flying in. So let's see what we have. All right, so one quick question here that said, I was told today that I had 2 follicles prior to the trigger shot. Is there a preferred amount of follicles or eggs?
That's a good question. So it's hard to, everyone's going to have a different number of follicles, and having more follicles is nicer because you'll have more mature eggs that we're able to retrieve. But good to remember that you only need one healthy embryo to have a healthy baby. So keep the faith in that one of those two eggs is going to create a baby.
Thank you very much. Yes, and these also, understanding what you're getting into and what the outcomes will be are very helpful throughout this process to kind of set your expectations correctly and to understand what you're going through. And that actually ties very well into this next question, also from Star. So Star is really thinking kind of big picture here, and I like this.
Okay.
Are we able to, Laurel, are you able to kind of share more information about the whole process itself from beginning to end with the 5 days of medication here in this situation and the trigger shot? So from when she first starts all the way through to making an egg, just to kind of give an idea of how those different medications work together to get her to her ultimate goal here.
Well, that's a hard question to answer without knowing what your protocol is. Some protocols use Gonal-f and Menopur, and then they use something called an antagonist, which is ganirelix or cetrotide, and that medication keeps you from ovulating prior to the egg retrieval. But I don't know your protocol, Star, so I'm not really sure how to answer that. I do know that it typically takes about 10 days of stimulation medication to get to the mature stage. And when your follicles are about 18 to 20 millimeters in diameter, that's when they are mature and you will be told to take the trigger shot.
Perfect. And yes, Star, again, some of these questions are things that, although we could walk through the process, it's very difficult without knowing exactly what you're taking and what you're doing. And those are questions that are much more applicable to your HCP when you're in there, to really have them walk you through each of the medications they're prescribing and how those things are working kind of in concert with one another to get you to the outcome that you're looking for. But hopefully, as we've walked through these 3 products today, we've given you a little bit of a perspective on how each one of these 3 products work. And we're more than happy, like I said, there's always go back. You can check out the PharmAssist other videos that we have available that will show you how other products also work within that. So if you're not necessarily just using these 3 products, there are other videos you can watch that explain how those products work as well to get you to that outcome that you're looking for. So always feel free to check out the PharmAssist page on our page, mymandelsPharmacy.com. You can get more information there. You can reach out to your pharmacist, and you can definitely always connect with your healthcare professional and ask them a little bit more questions about that. So that right now, let's see, I think we are all caught up on questions as of right now. So I will throw it back over to you as we give people, a couple more minutes maybe to type in their questions, and then we're ready to go.
Okay. So I just wanted to make sure that everyone knows that you can go to mymandelsPharmacy.com and you can watch individual videos that are specific to the medications that you're taking. So you don't have to watch an entire program. You don't have to skip through things. You just type in the one medication or the 2 medications that you want to watch, and you can watch those individual videos, and it doesn't have to have the question and answer commentary either. You can also find these videos on YouTube just by typing in Mandel's Pharmacy and Laurel Meyer and the medication you want to watch, and my video will show up. I just want to make sure that, are there any other questions, Craig, before I close?
No, as of right now, we are good to go, so we can start wrapping it up.
Okay. So I just wanted to thank everyone for your time and your patience. And I just wish everyone the best of luck. And I hope that I have given you the courage to give your own shots. I know you're going to be a pro by the end of this. And good night.
This medication video is to show you how to prepare and inject the Gonal-f ReadyJect pen. First thing to let you know is if you are being prescribed the Gonal-f pen, Mainly you're using that to help stimulate follicles or eggs, multiple follicles and eggs, to grow throughout your cycle. So Gonal-f is a stimulation medication, and it contains the hormone of FSH, which is follicle stimulating hormone. So that's the big one that's responsible, whether you're doing an insemination cycle or an IVF cycle. It's helping your body recruit and develop multiple eggs. Once again, I always like to ask or mention first, the supplies that are needed for the Gonal-f pen is one Gonal-f RediJect pen and one small needle tip that's provided for you with your pen. Your pen will come in a box, a kit of its own, and the needle tips and the pen will be in there as well. Couple little reminders about this medication is this medication is, again, a subcutaneous injection, like some of the different medications for fertility. So it's administered in either the lower belly or the upper top outer thigh area. That's routinely where, I know for me, our clinic, that's where we have our patients injecting. So you always want to follow your clinic and your nurse's instructions, but routinely that medication is administered in that lower belly and those upper outer side thigh area. So that's a subcutaneous shot. It's a little tiny needle. So again, you have an option where you could self-inject this medication or someone could administer it to you. There's no right or wrong. It's whatever works for you that helps you get through your cycle. So don't feel badly if you hear somebody else saying they give their own shots and you're not comfortable. We want you to always be comfortable with what you're doing in your cycle, and for everybody that's different. So whether you'd like to self-inject or have somebody give you your shot, whatever it takes to help you through the process is most important. With your Gonal-f pen, it may come from the pharmacy and it may suggest to keep it in the refrigerator. Based on the manufacturer's description with this in terms of keeping it refrigerated, if you keep it refrigerated, it's good until the expiration date. If you keep it outside of the refrigerator, it's good for the expiration date or 3 months, whichever comes first. So either or is fine. Oftentimes we just tell patients to put it in the refrigerator because then that gives you the whole time frame and you don't have to worry about calculating. It's just good until that expiration date. Can I take it out of the fridge before injecting? And the answer to that is absolutely. You can put it on the counter for approximately 15 minutes or so. It just brings it up a little bit from that refrigerator temperature and makes it a little bit easier, a little less feeling that you might notice when you inject that liquid. Typically, this medication will not sting, but you'll feel a little pinch with the needle. And sometimes if that fluid's cool, you might feel that too. So certainly you can put it out on the counter and let it warm up a little bit before you inject. So for your supplies, we have the Gonal-f pen. The first thing we do with that is we uncap this pen. And the next step is, it is sterile, guys, under there after the first time you use it, but it's just the nurse in me always has the habit of whenever I'm poking a needle into a surface, I clean that surface. So I'm cleaning the surface because I'm going to poke a needle in here. And the needle that I'm going to poke in comes with this product. It is a little needle tip. You just remove the little seal and then gently attach it. Don't over tighten because you are going to have to take that needle back off when you're done. So you don't want to over tighten too hard. So you just want to tighten it a little bit. And then next step is going to be to follow your clinic's instructions with your dosage. In here, what you will see is there is a little dial and there are some numbers. There, right now it's on 0. What you would do is you would turn to whatever dosage your clinic tells you. So I'm just going to turn this, and by the way, this dial can turn in either direction. So I'm going to turn this dial and I'm just going to simply set it to a dose of 150. So you might be able to see that in there, that it's a dose of 150. Again, that'll be determined by your clinic. The other thing I'll mention with this just quickly is a lot of times patients say, when will I know if it's empty? When you give a dosage after you inject, the dial goes to 0. When that dial goes to 0, that means that you still have medicine in that pen. So put it in the fridge and use it for your next injection. The goal of this pen nicely is that it's already mixed and it's multi-dosed, and you're going to use it up until you're done. Eventually what may happen is when you turn your dial to your dose and you give an injection, if there is ever a number that is not a 0 in that window after giving the shot, that's letting you know, hey, I couldn't give you that injection because I'm now empty. So you would discard this pen open up and get a new pen with a new needle and turn the dial to whatever dose this one stopped at after you finished your injection. So if it stopped at a dosage of 50, then you would open a new pen and give just a 50 unit dosage. The other thing I wanted to mention is the pen is multi-dose. The needles are one-time use. You always only put a needle on, give an injection, and discard that needle into your sharps container that will be given and provided to you by the pharmacy. So the pen itself is multi-use, but not needles. Needles are one-time use, and then you discard, okay? For injection technique for this one, like I said, just to show you that, it will go in either the belly or the upper thigh. So just to get our little mannequin here, in the upper belly, lower belly area, not upper belly because we have some muscle up there, and in our upper thigh, outer thigh area because we have some fatty tissue. So we want to avoid muscle. This is a fatty tissue shot. So if I were giving this mannequin an injection in her belly, I would have her possibly lay down like this, and I would administer the needle to go straight in 90 degree this way, straight in 90 degree this way, or if I'm giving it in the side thigh, it's 90 degree this way. So that would be if she were laying down and I were administering. If she's self-administering and she's standing or sitting, she would be in this position. So what we would want to do to get ready is the first thing is uncap your pen with the big cap and save it, but turn it so that the part that's open is facing up on the counter. And then you'll see that there is a green color here on the tip. We get rid of that one. Don't try to put that back on. I've watched patients do that and they actually stab themselves, and I don't want you to do that. So that one goes in regular trash. Save the other one. And then what you're going to do is you have to clean that area of the belly so that it's good and clean for this injection. And just a little key with your shots, guys, and I'll show this with my arm, is when you're pinching the skin for a fatty shot, you want to give a gentle lift. If you squeeze really hard, you're going to bruise. So sometimes when patients come to me with bruising, I actually have them lift gently so that make sure that they're not squeezing so hard. It's just we're kind of nervous, so we squeeze a little harder, and then that can cause trauma to the skin. So it's this one, it's a gentle little squeeze. Again, we do not have to jab this needle. Just place it to the skin, give a little push. That needle goes all the way in. Once that needle's in, then you are going to push on the end of this pen and push all the way until you feel almost the pressure that you can't push anymore. And once you feel that, count to 1, 2, 3 and let go. Then remove the needle in the same angle that it went in, set it down, and put a little cotton ball to that area. Wipe it if you need to. Usually you do not need to band-aid these areas because literally the bleeding stops very quickly. And you'll be able to touch the area after you've given the shot because you won't have felt anything other than the pinch of the needle, which is like a mosquito bite, and usually you will not feel the medication going in. Now what I do is I take a look at that dial, and I do have a 0 in my window there. So that tells me that this pen has more medication. So what I'm going to do is I take the cap and I put that needle into that cap, and I give it a little pinch, and I twist that dirty needle off that I used. I discard it into a sharps container that I will have from the pharmacy, and I reattach the pen cap, and the pen goes back into that refrigerator for your next use. So keep in mind, this medication is subcutaneous, meaning it's a little fatty shot in those thigh or belly. It contains FSH, which is the follicle stimulating hormone, which helps your body recruit and develop those multiple eggs, whether it be that you're doing this for insemination or for IVF. Hope this helped you with your Gonal-F, and best of luck with that medication.
All right. Thank you again, Wanda, for that excellent presentation. We appreciate it. And once again, everybody out there, if you have any questions, feel free to get them into the chat or either on Facebook or Zoom. And speaking of which, the first question coming in is, should I treat the area before an injection? Is it painful? Oh, Wanda, you are still muted, by the way.
Okay. Usually with the subcutaneous injections, because they're not going so deep and they're going just into the fatty tissue with that much finer, smaller needle, it's not usually needed to have to treat beforehand most often. So usually what we would recommend, though, is if you do, you might look at something like that Centerra patch that has been brought up in a couple of the videos from tonight, and you can talk to your clinic about that if you really, we don't want you to be so worried that you can't proceed forward with your shots, because that might be something that really for you would benefit you, and it's a bit of a numbing cream. So it's a prescriptive numbing cream. So that is something to talk to your center about. But as far as icing goes, often with these little shots, it's not even warranted, because again, it's going in to such a small area within that you don't want to close off the little capillary vessels in the fatty tissue, and you want that medication to absorb. So not putting the ice there, which can constrict blood flow. You want to keep nice blood flow open for the absorption. So usually if you've had a blood draw where that needle went into the vein, it's less than that in terms of a pinch with this medication if you don't use any numbing cream.
Awesome. Thank you so much. And actually, I think you basically covered just about everything else. So as of right now, there are no additional questions in. As we mentioned earlier, there's a time now. If you have any additional questions, anything else that you are thinking about, the first two products as well, the HCG or the progesterone or the Gonal-F, you can definitely get them in now, and we will get a chance to answer them. But I think as of right now, you covered everything in the video, Wanda. So if you want, I will throw it back over to you. If you want to, while people are getting a chance to, if they have any other questions, you can move on to your little presentation at the end.
Sure. Thanks, Craig. So hopefully tonight's Q&A and the Mandel's PharmAssist program has provided you with some nice tips, some nice information, and hopefully confidence in feeling that you can tackle these shots and you feel like you can be a pro. Keep in mind that all of these videos, including tonight's video, will be in the Mandel's PharmAssist video library, and you'll be able to watch those at any time. And I think that's a great benefit of this, is because sometimes we need to see things more than once. So whether you are somebody that arrived tonight and you have not started your cycle, or you are mid-cycle and you've been using the medication but you want to learn more, you know, that's why it's there for you to be able to review again these medications. So I think that would be just really important to know, and this is a great program for allowing you that ability to have live questions as well as reviewing those videos. The final piece of this, when I was asked with the progesterone injection, anything else you can do to prepare, Craig, I think you have there available to put up on the screen what we call the self-mind clearing technique. And the self-mind clearing technique, this is just something that is an added little bonus that I've added in as not only a fertility nurse, but as a certified healing touch practitioner. Well, let's face it, everybody can feel sometimes a lot of tension in their head when they have a lot to think about, a lot to plan for, and sometimes we can tense up the area of our head. So even if you're not doing fertility, this is beneficial. Share it with anyone that you know, especially during you know, stressful times. The mind clearing's purpose is to promote relaxation and a sense of peacefulness. And so if your body and your energy feels peaceful and relaxed, that can be helping you in how you interpret these medications going in. Your body will feel more relaxed. So all you need is about 10 minutes. Put yourself in a nice quiet room. Put on some nice calming music, whatever that is to you, subtle music in the background. And each of these positions that you hold, first one is starting off, you can set a nice intention of, I feel safe, I can conquer my fertility cycle, I am able and able to proceed with my cycle, and everything will be well during my cycle. Set any little intention, and that's what you're doing by giving yourself a mini hug. And then each of these little positions that you will see, you do a light touch and you hold it for approximately 1 minute. And what you'll find, and what you should find at the end of each of those pictures, is at the very end, recite your intention again for your cycle. And you should feel a sense of calm and pay attention even the next day. And I encourage you to do this at the start of your cycle or at any time that you might just need to feel that You want to empower yourself to feel relaxed and promote a sense of peace and well-being. I thank you to Mandel's Pharmacy for this program, and I think it's a wonderful ability that we have to be live with you and to be able to record these. And so I will send it off to Craig to finish up, but I hope to see you soon. Remember, it's every Monday night at 7 p.m. and it's the live Q&A with different videos for you to take a peek at and see from nurses and healthcare professionals around the country.
Thank you so much. I want to thank everyone for making time in your busy schedule to spend it with us this evening in the PharmAssist program. I specifically want to thank all 4 of our nurses tonight. We had Karen, Caitlin, Laurel, and Wanda, each walking through one of the different products from their previous presentations from month 2 of the PharmAssist program. So with all that being said, I want to say thank you so much for coming in and listening to our questions, for providing those questions the first time around. Any questions that you may have, even though this is not a live program, you can post it up on the Facebook page, and we will definitely get back to you and answer you. I want to remind all of you that all of these full virtual learning experience videos, or VLEs as we call them, as well as the individual product demonstration videos, are all available on demand at our YouTube page, our Facebook page, and on our homepage, mymandelsPharmacy.com/pharmacist. We look forward to seeing you here, typically again every Monday night, typically live. We will be returning with our next live installment after Labor Day, but it's Monday night at 7 p.m. is our standard PharmAssist night, and we look forward to seeing you there for another great program. Please share the PharmAssist program with anyone that you think can benefit from it, friends, family, anyone else, other friends of yours who might be going through a similar circumstance like this. But we really do appreciate that you share this information so more people get a chance to benefit from it. So thank you so much once again. Have a great evening, and we will see you again live when we return after Labor Day with the live PharmAssist virtual learning experience program. Thanks again. Have a great night.